Welcome to Shri Medical College. Today we will explore Operation Theatre Careers, exploring the different roles and opportunities in the field. The operating theatre is a vital part of any hospital or medical facility, where life-saving surgeries are performed. This highly specialized environment requires a team of skilled professionals working together to ensure the best possible outcomes for patients. Operating theatre careers offer exciting opportunities for people who want to work in healthcare and make a difference in people's lives. The environment in an operating room is sterile, the furniture is sterile, the lighting is sterile, and there are screens and monitors for the surgeon to use if necessary. In most cases, operating theatres do not have windows, while those installed in newly constructed theatres do, so that medical staff can benefit from natural light. Such rooms also have climate control systems. Extraordinary air handlers clean and pressurize the air so that it stays at a constant comfortable level. In event of an electrical outage, backup generators are ready to kick in. Wall suction, oxygen, and possibly other anesthetic gases are all provided in each room. The anesthetic machine and operating table are two essential pieces of equipment. There are also tables available for instrument preparation. Space is provided for the safe keeping of standard operating room equipment. Disposable items can be stored in designated bins. Surgeons, anesthesiologists, ODs, and nurses use a separate scrubbing space before surgery, either inside or outside the operating room. The terminal cleaner in an operating room will have a map to follow so that the operating table and other equipment can be reset to their proper positions. The usual auxiliary spaces for an operating room are the anesthetic room, the preparation room, the scrub room, and the dirty utility room. To comply with international infection control standards, all operating rooms have specialized flooring and air handling devices that are matched to the air exchange rates. Each operating room contains LED lighting, anesthetic workstations, multipara monitors, defibrillators, warming machines, central suction, medicinal gases, skilled nurses, and paramedics. The surgeon is responsible for performing the surgery. They are highly skilled professionals who have undergone extensive training and education. They work closely with the other members of the team to ensure the surgery is successful. Surgeons are highly skilled professionals who perform surgery. They must have a medical degree and undergo extensive training and education. Surgeons specialize in various fields such as neurosurgery, cardiovascular surgery, and orthopedic surgery. The surgeon may also benefit from enhanced vision with the aid of specially designed glasses. The anesthesiologist and circulating nurse aren't members of the sterile team, therefore they won't be required to wear gowns during procedures. They are not allowed to get closer than 12 to 16 inches to anything or anyone in a sterile area. The anesthesiologist is responsible for administering anesthesia to the patient. They must carefully monitor the patient's vital signs throughout the surgery to ensure they are stable and safe. Anesthesiologists are medical doctors who specialize in anesthesia. They must have a medical degree and undergo extensive training and education. Anesthesiologists work closely with the surgical team to ensure that the patient is safe and comfortable throughout the surgery. The scrub nurse is responsible for preparing the operating room and assisting the surgeon during the surgery. They must ensure that all of the necessary equipment is available and that the surgical instruments are sterile. The nurse is responsible for ensuring that the operating room is safe and sterile. They monitor the patient's vital signs and assist the surgical team as needed. Nurses are an essential part of the operating theatre team. They can work as scrub nurses, circulating nurses, or recovery nurses. Nurses must have a nursing degree and undergo specialized training to work in the operating theatre. The surgical technologist is responsible for preparing the surgical instruments and equipment. They work closely with the surgeon and the other members of the team to ensure that everything is ready for the surgery. The recovery nurse is responsible for caring for the patient after the surgery. They monitor the patient's vital signs and ensure that they are comfortable as they recover from the procedure. Surgical technologists work closely with the surgical team to ensure that everything is ready for the surgery. They must have specialized training in surgical technology and equipment. Sterile processing technicians are responsible for cleaning and sterilizing the surgical instruments and equipment. They must have specialized training in sterile processing and must ensure that everything is ready for the surgery. Operating theatre technologists are responsible for overseeing the daily operations of the operating theatre. They must have a degree in healthcare management or a related field and must ensure that the operating theatre is running smoothly. An operating room technician is a specialist in charge of setting up and maintaining operating rooms and their associated equipment before, during, and after surgery. They also support patients who are recovering from surgery by working with the surgical and anesthesia teams during surgical procedures. Each step of the surgical procedure must be as safe and effective as possible, and it is the job of these professionals to make sure that happens. The operating room manager prepares the dressing table, operating table, instrument table, and anesthesia table and maintains all surgical gear. They also sterilize the operating room's linens, drapes, anesthetic gases, and medications. Together, these sterile and non-sterile instruments are regulated to ensure proper operation. Operating theatre professionals must pay close attention to detail to ensure that everything is ready for the surgery. They must also carefully monitor the patient's vital signs throughout the surgery. Operating theatre professionals must be able to think critically to make quick decisions in high-pressure situations. They must be able to troubleshoot problems and make quick decisions to ensure that the surgery is successful. B.VoC in Operating Theatre Technology Eligibility Criteria. 12th class from any recognized board. Students, arts/commerce/science, of any age can apply. A minimum score of 50% in the 12th class. Join Shri Medical College's Bachelor of Vocation in Operation Theatre Technology and take the first step toward a successful career in Operation Theatre Technologist. We are here to assist you in launching your career as an Operation Theatre Technologist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, Please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.